My talk this afternoon will be focusing on stigma and discrimination in terms of transgender perspective. So I will share my own experience based from the implementation at the Tangerine Clinic based in Bangkok, Thailand. So before we start with the next slide, I would like to give you the definition of the transgender people first, because in Asian we are very diverse, as Martin mentioned. So here, this is the definition identified by the Asia Pacific Transgender Network, where I used to work with them before. So transgender individuals mean persons who identify themselves in a different gender than that assigned to them at birth. They may express their identity differently to that expected of the gender role assigned to them at birth. Trans or transgender persons often identify themselves in ways that are locally, socially, culturally, religiously, or spiritually defined. So it's the term transgender identity is very different, even from East Asia to Southeast Asia, or South Asia, or even in other region of the countries as well. So, and it was estimated that there were around 300,000 of transgender women living in Thailand. So the data was actually generated by the Ministry of Public Health for the HIV programming purposes. So it might not be accurate, but at least we have the population size estimation. And these are the overall sexual and gender-based violence among transgender people in Thailand. And I got many sources of data that I would like to share with you here. So by the end of 2017, we found that around 19 transgender persons were murdered in Thailand due to their transgender identity. But we believe that the number would be more higher than this, because many transgender people are misgendering in the newspaper, on the tabloids, or because of in Thailand you cannot change your gender identity whether or not you have undergone your sex reassignment surgery. So your gender marker will still be classified as your sex assigned at birth. And 29% of them, they reported that they experienced sexual abuse in school. So this data was generated by the Transgender-led organization, and together with the support from Transgender Europe Council with the funding support. And 6%, they experience physical abuse from their family members. Family is the very primary institution that raised by Martin already. And almost 50%, they had negative experience from healthcare providers, especially from public health hospital in the country. And in the context like Pattaya, where you perceive that is the city of the sex industry, we actually don't have the beautiful beach, but I don't know why many people want to go there. So we learned that almost 60 of transgender women sex workers, they reported arbitrary arrest in Pattaya by the law enforcement officer due to the carrying condoms and lubricants, or walking on the street without any paying the bribe to the police or something like that. So due to the transgender identity, put them more vulnerable than other key populations in the city. And right now, coming to in healthcare setting, we found that almost 50% of the respondents, they said that they never received advice and counseling from healthcare providers on gender-affirming care and hormone use at all. And this is the same data from the previous slide, and this is very alarming. We found that 15% of healthcare workers, they thought that HIV positive transgender women should be ashamed and blamed. So it's showing that multiple marginalized identity, which is came from HIV status and transgender identity, that lumping together and make them even more vulnerable in the society. So we can now see, as a transgender individual, we're facing many multiple marginalized vulnerabilities. Family rejection, we dropped out from school early, and we went to Bangkok, we went to Pattaya to look for work. But with very low educational level, there's not many jobs for us to work as a transgender youth. physical and sexual violence happening almost every day. Since we came out of the room from the apartment, we were harassed by the motorbike, we were harassed by the neighborhoods, or we were physically harassed by our peers and colleagues in school. And in terms of employment opportunity, it's still unequal. Even, for even myself, I used to face with the unequal employment opportunity when they learned that I'm a transgender woman. Institutionalized stigma and discrimination remain a concern in Thailand, especially in terms of legal gender recognition. We still don't have any gender recognition law for transgender people in Thailand. So many of you might have perceived that Thailand is the paradise for LGBT. You always go to Pat Pong, you always go to Siloam, but in reality, it's not a paradise. It's just the Thai society just opened some certain space for transgender people to live in. We can be only a comedy or a joke in the TV program. We can be working in the cabaret show. We can be a very famous makeup artist, but we cannot be the civil servant. Our employment opportunity is not equal like you sitting here, general population, cisgender men and cisgender women. In terms of health disparity, of course, that I already showed you before. Access to safe hormone use, it's very limited, and also including the gender-affirming surgery as well. HIV and other sexually transmitted infections remain a great concern, and that's why it all brings us here today. Mental health and substance use is already raised by Martin. So I would like to bring you to the rationale of the establishment of the Tangerine Clinic, why we have to set up a transgender clinic. So at the Thai Red Cross at that time, we were thinking what we can do and how we can do to serve this vulnerable population. They started by employing me first. So I got a job at the Thai Red Cross. So thank you very much for the leadership, because they see the importance of having a transgender representative there and make my voice heard among them. So we learned that we need to do something about transgender people, and we learned that in Thailand, there were around 60,000 of transgender women who were sexually active, and of those, 13,000 of them, they're at high risk of HIV acquisition. And the HIV prevalence in 2000 and actually in 16, it was around 13.8% nationwide. So it's not easy for us to establish the clinic at the first place. We have to consult with the transgender community. We have to change the attitude of the healthcare providers. We have to do many things. Before we open the clinic, we have to provide the gender sensitization training to healthcare providers. And I'm very fortunate because the leadership of the organization, Professor Prapan, had the gender sensitization training as a mandatory policy before you provide direct contact to transgender individual as a client. This is the first important step. Before we opened the clinic, we conducted a gender or stigma audit where stigma might be potentially happening in the clinic and throughout. Even at the security guard, at the entrance, where the stigma might be happening, we were verbally harassed by the security guard because of our transgender identity. We have to educate them, we have to work with them, we have to let them understand the way we are. And also moving to the clinic, we have to change our forms, data collection form. We cannot use only male or female. We have to open the options for transgender identity and provide their open gender marker. And we have to let them choose their preferred pronoun and their preferred noun as well. We are not going to use their name or their feminine name according to their national ID card at all. This is the way to show respect of the transgender people in the communities. In terms of healthcare training, of course, healthcare providers receive the transgender health-related training, gender-affirming hormone therapy, which has been led by Dr. Nipat, who's sitting there. He's very valuable to the establishment of the Tangerine Clinic as well in 2015. So the principle behind the Tangerine Clinic, even the name of the clinic, the name is actually was selected by the community. It was originated by Dr. Fritz, but the name Tangerine was also chosen, was nominated at the transgender community consultation, and it was finally mutually agreed by the transgender community that, okay, we go for this name because we liked it. It showed us we having the ownership of the clinic as well. So the first thing is the clinic should be community-led and community-owned response. So the characteristic of the clinic right now is transgender-led. 80%, 90% they are transgender women. We might be having people transitioning more in the future. No, I'm joking. The clinic is very gender sensitive, as I told you before. It's stigma-free because we conducted stigma audit in every step of the services. But the clinic is not sugar-free because we're receiving snack every day from our clients. Our staff is overweight now. And we respond to the comprehensive health needs of the transgender people. We are not only talking about HIV, STI, PrEP, ARV alone. It's boring, right? As a transgender person, we want to hear something beautiful. We want to learn something sexy, things to make us healthy, but stay beautifully, confidently beautiful, right? Like Miss Universe. So we integrated the hormone treatment because this was originated from the transgender community consultation as well. Otherwise, we wouldn't know that this is their greatest needs. And this is something that they are looking for. So if you work with transgender community, it's unavoidable that you're not providing the gender-affirming hormone treatment for them. So this is the Miss International Queen. So, and here, before we opened the clinic, it was very difficult or it was impossible to identify any transgender client at the anonymous clinic at that time. But right after we opened the clinic by end of 2015 and until April 2000 and this year, we have more than 2,800 transgender clients receiving the services at the Tangerine. Before they were underserved in terms of HIV services or healthcare services with more than 8,000 clinical visits that they receive. So one person coming back every year. So, and of those, they are transgender women. And the HIV testing uptake was very high. If they tested positive, they're going to start initiate ART on the same day of the diagnosis, if they are eligible. So the ART initiation rate was high as well. It was around 93%. And we learn different things, we learn new things when we're providing the services to transgender people. However, when we talk with them, when we provided counseling, we learn that in their daily life, there's still sexual and gender-based violence happening for transgender clients. This is the data that we collected and analyzed at the beginning of 2018. It was very old, but it's still useful. We found that 17% of transgender clients at the Tangerine, they were bullied by their classmates. And the average age was around 12 years old. So I experienced that bully in the school as well. And 6%, they reported that they were physically abused. Of those that were physically abused, 25% of them, they were abused by strangers, and 20% they were abused by neighbors. So the average age, it was around 18 years old. 5% were coerced into sex, which the average is on 17 years old. And most took place by the colleagues and by siblings. 38% felt rejected due to their gender identity. Of those who felt rejected, it happened 51% when applying for a job, 13% in school, 13% refused to use the public services, and 13% when seeking health care. And last point is 16% they experience public shame due to their gender identity. When you go out to any public space in Thailand, you're gonna get verbally harassed easily. But it's the way how you deal with it, or you just want to ignore it, or you just want to go and hit them. So it depends on your defensive mechanism is and how you empower to protect yourself. So guess which my defending mechanism is? So here is a story I just want to share with you, a very sad but impressive story at last, because we found that it's a story from the survivor from sexual violence. We found a transgender girl. She was 14 years old at that time, and she visited the Tangerine with her mother because it was school holidays, and she came to the Tangerine because of the hormone level monitoring. So she asked her mother to bring her to the clinic because she knows Tangerine from her from our Facebook page, and she really wanted to come and follow her transgender social media influencer. And when she met with our transgender counselor, she reported that she was sexually abused by a senior classmate, and it was happening 2 or 3 years ago before she's presented at the clinic. And we offered her the HIV testing, and she agreed to have HIV testing. Unfortunately, the HIV testing result was positive, and she had very low CD4 count at that time. However, it was very emotional for us on the Tangerine clinic staff, because we had no experience in providing services to transgender adolescents before. So we decided to contact with the ID pediatrician at the Chulalongkorn University Hospital, and we trying to establish the referral linkages for her to access to initiate the ART on the same day of the diagnosis. But it was very happy ending because she decided to share the HIV status to her mother, and her mother had a counseling session with us. So finally, she's really supportive for her gender transition as well as her ARV adherence. So I think it was another story that I want to share with you. So this is the lesson learned and the next step for us that we're learning from the Tangerine implementation. We learned that transgender community-led and community-owned response is critical in increasing access to HIV prevention, care, and treatment. Gender-sensitive, non-medicalized, age-friendly, holistic healthcare settings are key to mitigate stigma and discrimination and to promote health-seeking behaviors among transgender individuals. Clear protocols to support those who experience sexual abuses, exploitation, and robust referral systems are strongly needed, and we are working to build up our own capacity to that level. Data collection from transgender health service program is crucial for development and refinement of health service package and health policy and advocacy for transgender people in Thailand. And here is because of the LGBT Pride Month, and here are the social media influencers who are the transgender client receiving the services at the Tangerine. So they really kindly to share the photo to all of you here to promote the LGBT Pride Week in June. And this is very capturing word. Transphobia in healthcare is unhealthy, and I hope that we wouldn't see that again in any of your clinics. Thank you very much. That's the end of my talk.